All right, welcome back. Our guest again, Dr. Maura Ogden and Abby Benoit. We're talking about wounds and how to get them all straight. And we're going to go to some of the services now. And Abby, I think you're going to take us through some of the services provided by Terrebonne General.
We provide recommendations for the most appropriate topical medication and specialty dressing for the wounds or for these patients. We also provide various forms of debridement, some of which include conservative Sharps debridement, which is your basic debridement, and also ultrasonic wound debridement. When we talk about debridement, that's another term a lot of people aren't familiar with. Debridement is actually the removal of dead tissue from the wound. This dead tissue impedes healing, so it's very important to have this tissue removed. We also do compression therapy for our venous ulcer patients that have ulcers of the lower extremities to help to reduce the edema or swelling that they have and promote wound healing. We make various suggestions for offloading for our diabetic patients that have foot ulcers and perform the paring or shaving of the calluses like Dr. Ogden mentioned. We make recommendations and perform dressing changes for VAC therapy. VAC therapy is very interesting, and it's a very popular advanced modality that we use in wound care. It's vacuum-assisted closure. This is a type of therapy that's typically used for our larger wounds and heavily draining wounds. It's a procedure where a sponge is actually placed into the wound and hooked to suction. The patients can be mobile at home because they make little small unit devices, but it helps speed the process of wound healing. We do nutritional assessments on all of our patients and make any recommendations. It's very important that nutrition is looked at because any nutritionally compromised patient will have trouble healing. Okay. We provide education to the patient and the family members and caregivers regarding the different steps in their wound care and different prevention techniques. We also do non-invasive testing of circulation to the lower extremities to determine if the patient even has enough circulation to the foot or the leg to heal their wound. We perform grafting with bioengineered skin. And based on our findings through our assessments, we make any necessary referrals that, as Dr. Ogden had spoke, whether we need to refer to cardiology if there's inadequate circulation, or a surgeon if more advanced debridement or grafting is needed. So we try to maintain good, open, ongoing communication, not only with the primary physicians and the specialists we deal with, but also our home health agencies in the area, our nursing homes, just so that we can all stay and work together on the patients that we share.
All right, very good. Dr. Ogden, the treatment plans, the particular types of treatment plan for wound care patients, what would they be? Can you take us through?
Well, there's not one specific general plan for all patients. All of our treatment plans are individualized, and when the patient comes in, depending on the type of wound that they have, we do an assessment trying to identify the causative factors for that wound and make corrections to whatever those factors may be. As Abby said previously, we also do a nutritional assessment. We may also do blood tests to check the patients for anemia. If they're diabetic patients, check a hemoglobin A1C, see how well their diabetes may be controlled or not controlled. We assess for bad habits like smoking, which definitely gets in the way of wound healing by constricting the blood vessels. And then after we do all those initial assessments for the individual patient, we see what type of wound care therapy, like all the therapies that Abby just listed, would be specifically beneficial for that particular patient. And one of the things that we have to kind of temper with patients is thinking that they're going to get their wound healed right away, that we can give them a quick fix, because
Takes time.
it takes a lot of time, especially with chronic wounds, which is what we mainly see. We can see the same patient for months, sometimes,
Compliance.
sometimes
plays an
even
issue.
years. We don't like to see patients for years, but
You
we
say
have
compliant, that's important, huh?
Yes, the patient complying and following with our recommendations.
All right.
Right, and stopping bad habits.
Yes.
So I got to ask y'all both a very important final question. Who's the bigger Saints fan, Dr. Ogden or Abby? Which one?
That would be a close one.
It's close?
It's very close, but I would say that I'm probably a bigger fan than Abby.
Oh,
even.
okay.
Yeah.
We'll have to take that up
It was
later.
good to loosen it up at the end. Thank y'all so much. I learned
All right.
quite a bit, and I appreciate y'all coming on tonight.
All right,
Thank
thanks a
you.
lot.
All right, we're going to take a break. When we come back, we're going in the kitchen with Chef George, the Canada's Kitchen, and Dana Porsche will join him in that kitchen. Don't go away.